VYZULTA, latanoprostene bunod ophthalmic solution, 0.024% is indicated for the reduction of intraocular pressure, IOP, in patients with open-angle glaucoma or ocular hypertension. Please see important safety information at the end of this video.
With regards to mechanism of action, I think it's key to note that VYZULTA has two mechanisms of action within one molecule. You have the proven prostaglandin analog effect of increasing uveoscleral outflow, but you also have this novel effect of the nitric oxide portion of the molecule, which increases trabecular outflow, which, as we know, is the primary problem in primary open-angle glaucoma and secondary open-angle glaucomas.
Nitric oxide easily passes through cell membranes because of its lipophilicity, and once inside the cell, it has a couple of different effects and ways that it affects the intraocular pressure. One is through reducing calcium, and the second is through inhibition of Rho kinase. And there's the uniqueness of the molecule. In addition, it's rapidly broken down and has an excellent safety profile systemically.
Nitric oxide is going to relax the cytoskeleton of the trabecular meshwork, increasing outflow. With latanoprostene bunod or VYZULTA, we're actually enhancing trabecular outflow. We want to enhance trabecular outflow because that will allow us to keep the trabecular meshwork and conventional outflow pathway functioning.
I think what we're seeing now in glaucoma is this excitement and this appreciation now for mechanism of action. And I think before these medications that we've had, such as VYZULTA, we didn't appreciate the impact of the conventional pathway. So we suppress the amount of aqueous, or we can divert fluid into the supraciliary space. But we want to also realize that the pathology in glaucoma is the trabecular meshwork and the Schlemm's canal and even the distal channels. So theoretically, at least for me, to have a drug that can not only help bring the pressures down, work on the uveitis pathway, but also have the ability to maximize as much as possible the outflow facility of the conventional pathway, I think is really the way to go.
VYZULTA, latanoprostene bunod ophthalmic solution, 0.024% is indicated for the reduction of intraocular pressure, IOP, in patients with open-angle glaucoma or ocular hypertension. Important safety information. Increased pigmentation of the iris and periorbital tissue, eyelid, can occur. Iris pigmentation is likely to be permanent. Gradual changes to eyelashes, including increased length, increased thickness, and number of eyelashes, may occur. These changes are usually reversible upon treatment discontinuation. Use with caution in patients with a history of intraocular inflammation, iritis, uveitis. VYZULTA should generally not be used in patients with active intraocular inflammation. Macular edema, including cystoid macular edema, has been reported during treatment with prostaglandin analogs. Use with caution in aphakic patients, in pseudophakic patients with a torn posterior lens capsule, or in patients with known risk factors for macular edema. There have been reports of bacterial keratitis associated with the number of multiple dose containers of topical ophthalmic products that were inadvertently contaminated by patients. Contact lenses should be removed prior to the administration of VYZULTA and may be reinserted 15 minutes after administration. Most common ocular adverse reactions with incidence of greater than or equal to 2% are conjunctival hyperemia, 6%, eye irritation, 4%, eye pain, 3%, and installation site pain, 2%. Please see full prescribing information at VYZULTA.com.